Thank you so much. My name is Gratien Tuyishimire. I'm an ENT surgeon. I'm working I'm leading a private hospital in Rwanda, in Kigali, but also an adjunct assistant professor at University of Global Health Equity at medical school, coordinating ENT courses, and I'm CHESA Fellow 2024. The first factor contributing is from the 1994 genocide against the Tutsi in our country. All health institution has been destroyed. There was nothing. People has died. 1 million people among 7 million of the total population is 1/7 died. So after this, many people has died. Other has fled in different countries. So the country started rebuilding, and also the health system. And the country started community-based universal insurance, and the people, they are having a means to access healthcare, and also the awareness is going high. So there is this awareness in the population that there is a ENT diseases which can be fixed, but also the very small number of ENT surgeons. I think those are the main contributing factors for this burden of ENT diseases. If I am in the position of mitigating this kind of problem, I think I will put more emphasis in training. For the moment, we are having ENT training program, one in the country from the University of Rwanda, and every year is producing 3, 4, 2 ENT surgeons. When we see the standards, international standard by WHO, it recommends at least 2 ENT surgeons per 100,000 population. So when we count and if you continue at this pace, this will require 89 years to have this standard. When everyone is still working, no retirement, no immigration, I think this, you see, it can't reach where we want to go. So I think increasing the number of maybe intake and training centers, this will help. And also I'm thinking, if I'm in this position, I would also advocate to have short training for maybe nurses, or they can manage something. Like when someone is coming with maybe a peanut in the nose from maybe 3 hours distance to reach Kigali, this stretches the ENT surgeon, and this is something which can be treated and solved from the place where, the village where the patient is coming from. I think training these people to have some skills, and also increasing the number of ENT surgeons, this I think will mitigate and solve the problem. Another priority I can put in is to have, for the moment we are having 23 ENT surgeons. Only one is having a subspecialty in head and neck, other they are just general ENTs. I'm thinking when you wanted to advance and to do complex and advanced procedures, you have to have people who has had a fellowship. I would put more energy also in having people doing subspecialty to increase the quality of care we are providing, but also to share a task, to do task sharing. If you are doing ears, otology and neurotology, a colleague is doing rhinology and skull base, another is doing pediatric ENT, another is doing maybe facioplastic and reconstruction. This is a way of task sharing, and also it will contribute in advancing the science, skills, and also the capability of the workforce we are possessing now. And this also can be a very contributing factor to invite young people, young doctors, to join ENT because they say maybe if I don't like rhinology, I can subspecialize in otology. So I think this is something I would put emphasis in. And maybe another thing I can do is to increase the collaboration between countries, maybe societies, ENT societies, whereby people with the special skills, they can come help in teaching resident and medical students, so that they can have experience from different people, not just local context, but you can also have input from people from other countries where the service of ENT maybe are more advanced vis-a-vis to our country today. Oh, of course. So with CHESA, I have had insight and also motivation to think about which kind of research I can do, which can have impact to the community where I'm working in. And also you have experience from different people. You have also you have opportunity to get a mentor who is maybe more experienced in the kind of research, who can give you the guidance, who can help you in different ways. And I encourage everyone to who is interested to apply and do such a CHESA fellowship, so that maybe if they're having a project in mind or an idea, can have a support, either financial support or even the mentorship, so that you can realize the project. And also you get a connection with different people, because in my project I'm doing in training GPs, general practitioners who are not specialists, to do some ENT procedures to decrease the workload we are having, and also to serve more the population. I got through CHESA and mentors, I have got some medical students from Harvard who is having more help in doing some administrative work, uploading a questionnaire on electronic softwares. So I think with CHESA you open eyes, and also you get in a connection and touch, you network with the people from different contexts and different corners of the world. So I encourage everyone who wants to join and to do this fellowship.